Hello, my name is Vitaly Mikryukov, a PhD in medicine. I'm so delighted that you are here. Today we continue the model Tattoo Removal Technology by Nd:YAG Q-switch lasers. The topic of this lecture is the initial consultation with the patient. After the lecture, you'll find a quiz on these topics. Let's get started. What needs to be discussed with the patient at the initial consultation on the removal of tattoo pigment from the skin with Nd:YAG Q-switch laser? In this lecture, we will analyze the general principle of consultation and the mandatory point that need to be discussed with each client. In future lectures, we will discuss the detail of individual tattoo areas and types of tattoos. I must emphasize the importance of the quality of the first consultation with your patient. Detailed and clear instructions and reasonable expectation influence your relationship with the patient and the likelihood of achieving a good result. This is a crucial point on which the success of working with the patient depends. Where do you start? First, ask the patient what he knows about laser removal, what are his expectations from the process and the result, so you will realize how realistic your patient's expectations from the procedure are. You will also get to know what points need to be corrected. It is necessary to start with a form of questionnaire regarding absolute and relative contraindication and filling out documentation. Obtain a complete medical history and sign informed consent before treatment. Depending on your country legislation and status of laser removal, the documents to be signed with the client may differ. This can be an agreement for the provision of medical services or simply voluntary consent to a procedure, consent to the use of personal data or some additional forms and documents that are required by the legislation of your country. You should clarify this in the state legislation. Also, another mandatory step is to photograph the initial state of the permanent makeup or tattoo to help identify future changes. If you later want to use the photo of your client's results on the website or on social network for advertising or to show to future patients, then you should take your client's permission to publish the photo, preferably written, in order to avoid subsequent legal claims. The next step is inspecting the amount of pigment in the skin of the subject, the uniformity of its distribution and skin condition. Wipe off all temporary makeup completely if you are dealing with permanent makeup, and in good lighting use a magnifying glass lamp or ring lamp to inspect the skin. Try to pre-evaluate the amount of pigment in the tissue and the uniformity of its distribution. Identify possible areas with an excess amount of pigment and focus on them. Draw the attention of your client on the fact that additional procedures on these areas might be required in the future. Also, be sure to take into account the presence of scars, if there are any. Often, patients do not suspect that the skin in the area of a tattoo or permanent makeup has a scar. Patients usually imagine a scar as a large postoperative piece that sticks out a centimeter above the skin and has a burgundy red color. In reality, a scar may differ from normal skin only in texture and minimally in color. However, it is necessary to document the starting condition of the skin and the presence of scar tissue at close range and in good focus on a photo. You need to show the client and make sure that he sees and confirms the presence of scar before the procedure. This must be done before you do anything with the patient in order to avoid further conflict. You must record that this is the initial condition of the skin and not the result of your laser exposure. If visually there are any signs of recent permanent makeup or tattoo procedure, then find out how long ago permanent makeup or tattoo was applied. If the application process was recent, then explain that it is necessary to wait for the full restoration of the skin, and only after that proceed with laser removal. On the face, the recovery period of the epidermis is from 28 days or more. On the body, I recommend holding on for up to 2 to 3 months. This is due to slow regeneration and purification of the epidermis from particles of artificial pigment. If there are signs of other skin lesions, then find out how they were gotten. Were these attempts to remove the tattoo at home by themselves with a chemical remover or unprofessional exposure to laser? In any case, it is worth waiting until the skin is completely restored before proceeding with laser removal procedures. Next, it is necessary to explain how pigment is removed from the skin. That at the moment of exposure to laser, only the pigment itself is disintegrated and skin cleansing occurs at the interval between sessions. That's why it is important to take those breaks. You need to explain the tactics of gradually increasing fluence, that is energy per unit area, and why it is important for safety and efficiency, and the appearance of frost during the course of the procedures. Don't forget to mention that the space gaps between the sessions will gradually increase. In fact, gradually the skin cleansing process will slow down. All these features must be conveyed to the client. We discussed these points in detail in a lecture on the tactics of conducting a laser tattoo removal course. If necessary, watch that lecture again. A very important mental note. Do not be afraid to spend time on the initial consultation. This is a key to communicating with clients and building trust. Try to include all the details and side effects of the procedure in the consultation. Discuss possible complications and results. At this stage, you will demonstrate your professionalism and build your patient's trust. If you hide or simply forget to talk about some details, then in the second or third session, if the patient encounters those details and asks you questions, his level of confidence in your words will drop. So, pay maximum attention to the initial consultation and answer all the patient's questions. Remember, what seems obvious to you is most often unknown to your patient. It is important to create realistic expectation of both the result and the process. Talk about all the reactions and side effects that may occur. So, in the course of this lecture, we've discussed the initial consultation with your patient. In the assignments for this lecture, you'll find a quiz to consolidate your knowledge. See you in the next lecture. I've been Vitaly Mikryakov, and as always, thanks for listening.